how we can prevent it and why some factors actually cause it to happen. So we can just look through this later after the program is over so that we can develop a good understanding of this. I know this may be new to many of us. Next slide. Next slide. Yeah, so now that we've explained the mechanism by which cancer happens, we have a lot of causative factors. And the first thing is to mention to us is actually that most cancers, you can't actually put a hand on what caused it, actually. You cannot put a hand on it. Okay, this is what caused it. So that's the first thing we must know. And now, however, cancers, the cause is usually divided into three broad aspects. We have the genetic, that's the one you have now, that is transmitted from up down, from parents to their kids. And those are generally of two, that accounts for like 15% of all cancer, 15% of all of them. Now, that genetic cancers now, they are of two kinds. Also, there's the ones that are how do I let me put hereditary, sorry, not genetic, they are hereditary cancers, and there are those that are sporadic. So we can divide them into two broad groups: hereditary and sporadic. Sporadic means it's just came. Now, the hereditary, you can divide it into two. There are some that are genetic, that have a specific genetic base. And there are some that are familiar. You can't put a particular hand on the particular gene that is responsible, but it just forms in clusters in families. You just know that some families just tend to have this thing. Now, that genetic aspect forms about 5%. The familial one is 10%, while the remaining 85% of cancers are sporadic. We call it sporadic because there's no genetic basis for it, and there's no familial basis for it. Now, this the genetic one, I think there's something to talk about it. Usually has to do with particular genes. Now, everything has to do with genes. Cancer generally have to do with genes, but there are two kinds of genes. There are germline genes, and there are those that just occur along the way. The germline genes are the ones that you can transmit from a child to parent. Those are the ones that cause these genetically heredited cancers. However, even with that sporadic also, you can see all these causative factors I mentioned. Still, most of cancers, you can't really put a finger on any cause like this. You find people that have never smoked, never had all these things, that still have cancer. However, when we look at all these causes that I mentioned, when you understand how cancers form, you can explain easily why they cause cancers. For instance, tobacco smoke now. When people smoke tobacco, there's heat going into their lungs and all sorts of irritants. The irritants in the smoke, they inhale it. They inhale it into their lungs. Now, this continues irritating the cells in the lining of the throat, the mouth, the trachea, and inside the lungs. And usually when you irritate cells, that's, they tend to have, they have to be struggling and fight, they tend to deplete more, and they have to replace themselves more. Let's just put it like that. They have to replace themselves more. So the more they replace themselves, the more this DNA is being replicated, the more chances for having mistakes in the DNA replication, which will not pass through all those mechanisms, which all those mechanisms will not be taken care of. It's like someone that travels every day from Lagos to Maiduguri, travels to and fro 3 times a week. is more likely to have cancer than someone who is inside the, to have accident than someone who stays in his house. His house is just across the road from his office. Of course, the person whose house is across the road from his office and just goes from home to office, it can still have an accident on that small road. But someone that is going to Maiduguri and coming back 3 times every week has much more chance. So that's what causes it. So tobacco smoke also contains carcinogens, things that predispose to cancer because they irritate the cells, they kill cells. You understand? They are toxic to the cells, which make the cells die and need to be replicated more. Also, high alcohol consumptions is toxic to many, is also toxic to many organs in the body. In fact, medical school, once they ask you the cause of exposing factors to any cancer, don't say alcohol consumption, you will be right. So unhealthy diets also, unhealthy diets like low fiber diets, for instance. Let me give an example for colon cancer now. Unhealthy diet, low fiber diet predisposed to it because when you hit low fiber diet, all these processed foods, you know, there's no fiber there, so there's nothing for your colon to grip and push on. So they tend to stay long in the colon. So all those things that are fermenting in the food inside the colon, because the colon can't, there's a longer transit time. So the things that are inside us too that will be irritating the cells of the lining of the colon, they stay there longer, which affects the lining of the colon, which cause them to need to replicate more often and predispose them to having cancer. Exposure to air pollution, same thing. Exposure to radiation, also the same thing. Unprotected exposure to UV light, such as sunlight, which irritates, especially in those that in light-skinned people, because the UV light, the light is affecting the skin cells. You understand? Burning. That's why they have sunburn, for instance. They may have sunburns, so the skin has to be regenerating faster and faster. So as it's regenerating faster, the chances of them having cancers are more, based on that explanation. Then infection by certain organisms like bacteria, H. pylori, for instance, usually about 80% of like people that have said they have ulcer, usually by H. pylori. It's caused by this bacteria that swims within the lining of the stomach, and it has a tail. It will be irritating the whole cells of the stomach. So when you irritate them, the cells behave abnormally. They have to be replicating. They are shed off faster. You understand? I'm just simplifying the explanations for this thing. So once they have to replicate faster, the chances of mistakes being made during the DNA replication are more. So they are exposed to having it. So also viruses, including this HPV, human papilloma virus. If a human papilloma virus, usually sexually, so that's why you say cervical cancer is a sexually transmitted disease. So once the cells of the cervix are infected by human papilloma virus, you know, it irritates them, it has some toxic things that it does to them. They have to be replicated very much more often, predisposes them to cancer. The HBV and HCV also causes inflammation of the liver cells. That's hepatitis B, hepatitis C viruses. You know, so that is the general something. When you cause an organ to be inflamed, when there's toxicity to the organs, the cells have to be working extra hard to replicate themselves, to repair its damage. There's more likelihood for the DNA replication, which is used in all these to grow and to repair their tissues. When they are very active, there's more chance to have problems with the DNA and thus form cancers. So that's how all these things generally cause, as I said, some cancers just come without any predisposing factor. Next slide. Yeah, so now this is very important, the symptoms of cancer, because as I said, cancers, the best thing to do with cancer is to catch them early. That's the best thing. Even though there's treatment as advanced and everything, it's still the best thing to do is catch them. Almost all cancers, once you catch them early, you can treat them. They are not now compared to here. Let me give an example of breast cancer. Here, almost all, there was a study participated in. Let me talk about colon cancers, for instance. We have stage 1, 2, 3, 4. Stage 4 is the metastasis. That's the worst stage. 80% of our patients came in stage 3 and 4, while in the United States, about just 30 to 40% of them come in stage 3 and 4. You can see the difference. So if someone comes in stage 4 in the US and someone comes in stage 4 here, well, the treatment will still be better there, but the end result is usually still the same, really. So catching a cancer very early is the best thing. And one of the most painful things people should realize that we can see that on all these things I put down, pain is number 5. Usually people expect that since cancer is such a terrible thing, it must be very painful. No, it is not. Usually, for instance, if a woman comes with painful pain in the breasts, painful breast lump, it is not likely to be a cancer. Usually, especially if it's not very advanced, it's not likely to be a cancer. So lumps or growths on the body is the first thing we think about cancers. You can see a painless growth, come to the hospital, let someone check it out. Even if the lump is not painful. And usually, characteristics of cancerous tumors is that they grow relatively fast. If you see something that is not just the size of your thumb and it's been there for 10 years, it's not likely to be a cancer. However, if you see something like the size of the tip of your finger today, in 4 months is like your thumb, in another 10 months is like your fist, then one has to be very careful. So lumps of growth on the body, then unexplained weight loss. For instance, any elderly person with unexplained weight loss, one of the first things we think about that could be causing it is a cancer somewhere, usually colon. Person will have fever. No, actually, the kind of cancers that causes fever are the liquid cancers in quotes. Usually, people that have the leukemias, they may have fevers and drenching night sweats, usually at night. Fevers usually come and go. This is not a general thing for all cancers. Most solid tumors, you don't have fever. It's the blood tumors that you have fever. And that's usually because the immunity is low, the person now has infections on top of it. Then also, the tumors produce some things that cause fever in the body. Tiredness and fatigue. Then pain. Pain is usually late. Usually a late sign of cancer. Generally, it's a late sign of cancer. And this night sweat I mentioned is associated with the fever I talked about for blood tumors. Then constipation, changes in digestion. You just know that bowel habit, the person is having constipation now. Someone that used to go 3 times a week before now starts going once. Then diarrhea or constipation alternating with diarrhea also is problematic. Then if someone feels, you just notice that when you stool, you still feel there's stool there. You are always going, but they're still feeling there's stool there. That may be an indication for rectal cancer. Then bleeding from the stool also. Then changes in skin, then cough also.
Dr. Sharif,
yes.
You have 10 minutes more.
Yeah.
But we'll take we'll make it 15 minutes. So that we'll take 5 minutes off the question and answer session.
Yes, I'll speed it up.
So you have 15 minutes.
Yes, okay, good. Next slide. So those are the symptoms of cancer. Next slide. Yeah. So now to investigate cancer, there are 3. We investigate cancers to achieve 3 purposes: to confirm the cancer, to stage the disease.